Sonalee Kulkarni, and you are here with me at Where You Go First Matters, presented by Ruby Hall Clinic, Pune's expert care for over 60 years, since 1959. And you know what we do here. We have real talks, no shosha, no controversy, no exaggeration, no glamour. Just real sensible talk with real doctors from Ruby Hall Clinic. Today we have Dr. Mahavir Modi with us. He is a pulmonologist,
yes,
consultant, and sleep consultant at Ruby Hall Clinic.
Absolutely.
Welcome, doctor.
Thank you so much.
We talk about various things, but today the topic is lungs, sleep. Where do you want to start with?
Whatever, because they both are so much connected to each other.
I actually wanted to know, how are they connected?
Well, it's a very interesting topic, and after 22 years of practice, something which I have realized is basically lung health depends a lot on the sleep health.
Okay.
Because whatever our allergy system or the immunity, whatever it happens, it all happens in the deep sleep. So when we sleep, our brain goes through this N1 sleep, then N2 sleep, then there is N3 or deep sleep, and then there is REM sleep, म्हणजे साखर झोप. So your brain has to go through these all three stages followed by REM sleep. So every hour we go through these 4 stages, and once we have these 4 to 6 cycles over 6-7 hours, then our sleep is complete. Okay. So this deep sleep, N3 sleep, is the one where all your memory cells, where all your hormones, your sugar levels, your blood pressure, and your immunity, that all will be basically stimulated in your N3 sleep, deep sleep. So majority of the lung infections or even the allergies, asthma, COPD, so all these kind of lung problems, they have deep connection with the sleep. Okay.
Wow, हेच माझ्यासाठी नवीन आहे.
Absolutely. आणि बऱ्याच पेशंटला पण हा कन्सेप्ट असतो, especially nowadays because of whatever social media, people are sleeping late, they are getting up late, and they are basically forgetting the basic pathophysiology. Okay, our brain all works through, there is something called a suprachiasmatic nucleus, which is like the master clock of our body. Okay. So this master clock will basically act through the sunlight. Okay. सकाळी उठलो, सूर्याचे किरण आपल्या डोळ्यामध्ये गेले, so from there this your brain center will get stimulated. Okay, and each and every organ in our body, for example lungs, liver, heart, they all have one clock. Okay, and these all clocks, they are connected and they are managed basically by your brain. That is suprachiasmatic nucleus. And so all function basically depends upon the sleep. Okay, so you have to sleep as per the circadian rhythm. Okay, so circadian rhythm you must have heard about की बाबा प्रत्येक गोष्ट ही जेवण वेळेवरती पाहिजे, झोप वेळेवर पाहिजे, व्यायाम व्यवस्थित वेळेवर पाहिजे, and all these organs, these peripheral clocks like liver has a clock, lung has a clock, so these clocks also they will basically depend upon this master clock which depends a lot on the sunlight. Okay, तर झोपेची वेळ ही खूप महत्वाची आहे. So people those who sleep on time, get up on time, have 7 hours of good sleep, have timed meal, whatever exercise also on that particular time, so their biological clock gets very well set, and that is the best way to prevent any kind of lung disease.
Wow, very simply put.
Yes.
But nowadays lung diseases, infections are at rise. Yes. What do you think is the reason, apart from हे बिघडलेलं दिनचर्या आणि दिनक्रम?
I feel one of the basic reason why we are become more aware about lung problems is COVID.
Right.
Okay, so this is all after COVID that people have become so much aware की नाही मला श्वासाला त्रास होतोय. Of course, there are few papers. Now we have scientific data also which proves that those who had COVID, okay, almost 15-20% of these COVID patients, they have persistent lung inflammation. Okay. So त्यामुळे थोडा they will have cold, cough, they will have these recurrent symptoms, and we do get a lot of patients. I mean, they will say that, sir, पूर्वी कधीच नव्हतं. I never had so much of trouble, but since the time of COVID, I didn't have COVID. I had only mild COVID, but still I am getting cold, cough very often since that time.
Yeah, immunity
is gone. Plus they have become more aware of this. Of course, the major reason is pollution. GST cut झालाय, number of vehicles have increased. So I am the first one who will think, my goodness, if number of vehicles are going to increase, what will happen to our patients? So that is the most important thing. I think air pollution index, if you see, it is never less than 70 even in a city like Pune. Let us not talk about Delhi, Mumbai, but at least in Pune, so we have a lot of, that is one of the major reasons. Plus lot of garbage burning is there. Okay, even that will also cause, and do we have a very good strict industrial law? Okay, whatever is burning, whatever chemicals are there,
We don't
and
even know.
lot of constructions.
Yeah.
Most important, I mean, I am happy that somebody keeps on asking me, sir, what is the reason? And I can blame on the constructions. But that is actual story, because
Right.
everywhere some construction is
Yeah.
going on, and they get exposed so much to all of this. So outdoor pollution is there. Plus, India is the only country where we get something which is called as non-smoking COPD. Of course, we'll discuss what is
Yeah,
COPD.
I want to come to that.
Yes, but non-smoking, after that we still have chula use. We have chula, we have this whatever stove and those
Kerosene
kind
stove.
of kerosene stove. So all of these, they cause a lot of indoor pollution.
Right.
Okay, so these indoor pollution, outdoor pollution. Now Diwali is coming. Okay, so crackers.
क्रॅकर्स बद्दल बोललो तर लोक आपल्याला ट्रोल करायला येतात.
Yes, but these are all things which are actually causing this a lot of lung issues. Of
let's
course,
face
the lifestyle, the sleeping pattern, what we discussed, but along with this, all basically major pollutants. They are the one which have definitely caused a lot of these lung issues. Lifestyle बद्दल तर आपण बोललोच आहे, but even the junk food. Okay.
Yeah, the nutrition.
Nutrition diet, nutrition problem, because especially people, those who take a lot of food which contain lot of these preservatives,
Right.
okay, or the food which contain lot of coloring agents, okay, rangit mithai, rangit farsand, so those are the things which definitely
जे
are
आकर्षित
on
दिसतं
rise.
खरं तर त्याच्यापासून लांब राहावं.
लांब राहावं, yes. So
Wow.
they are all.
डॉक्टर मगाशी तुम्ही सीओपीडीचा उल्लेख केला. व्हॉट
Yes.
इज द डिफरन्स बिटवीन अस्थमा अँड सीओपीडी? दे साऊंड सिमिलर फॉर पीपल
Yes.
लाईक अस, लाईक कॉमनर्स.
It's a very good question, and I feel the audience also will be able to know that there are two different diseases, because we all know asthma. Okay, asthma म्हणजे basically ki whatever is allergy. Okay,
Right.
so that kind of allergy. So some people may have allergy on the skin. Okay, so they get urticaria. Some people may have allergic headache. So that is like migraine.
Right.
And some people may have allergic
So migraine
rhinitis.
is allergic?
It's also allergic. Yes, it is also one of the ways. I mean, people those who have asthma, they have more tendency to develop migraine also. Okay, even they mediate through this kind of Th2 kind of response, which is allergy response.
Okay.
And some people, if they get exposed to maybe cold or pollutants, they will get just running nose, sneezing. That is allergic rhinitis. And once it goes inside the lungs, then your airway or the air passage, there are millions of airways or the air pipes. So the arrangement or the what God has made lung, it's a very beautiful structure. If you just take an example of a tree,
Yeah.
and if you make it invert, okay, so inverted tree, that is your main bark of the tree, the stem, that is your air pipe, and then it keeps on dividing like into right and left lung,
Tranches.
and then it will keep on dividing millions of small airways. So whatever leaves are there, the leaflets, so they are all basically alveoli, where your all air exchange does happen, and lot of millions of small airways. So all these airways, because of exposure to say any kind of chemicals, or we have patients, you know, की मी जोरात हसलो तरी मला खोकल्याची उबळ येते. So there are people those who, okay, I go to some emotional, and then whenever I become emotional, I get a lot of bronchospasm. So all these they can trigger. So all these air pipes, they can go to a spasm. Okay. म्हणजे suppose if your airway diameter, if it has to be this much,
Yeah.
okay, it becomes shrunken. So somebody has to say give water through a pipe. Instead of that, if they have to give it through a straw. Okay.
Yeah.
So there is a lot of resistance which is required for that air to be to pass inside the lungs or outside the lungs. So that is basically what is asthma.
Right.
So asthma, we all know it is because of chemicals, irritants, whatever, dust, all those things. COPD on the other hand, and asthma हा disease असा आहे ना की today I had this symptom, tomorrow I am absolutely okay. Again after 2-3 days,
Yeah,
I
asthma
may
is
get
attacks
it's an
येतात.
attack. Okay,
Yeah.
it's just like an exacerbation, and the airway becomes hyperinflamed.
Correct.
Whereas COPD हा asthma सारखाच आहे. Here also your air pipe will become shrunken,
Okay.
but it remains more of a persistent kind of thing.
Okay.
Okay. So like in asthma it opens up. In COPD it normally doesn't open up that fast.
Oh.
Okay. So COPD is always, it's a chronic obstructive pulmonary disease. So it's a chronic, as the word says, that once you develop COPD, it will like keep on happening. Asthma also it is chronic, so but in between the patients will be good. In
Yes.
chronic, in COPD, they will have some symptoms every day. काही ऍक्टिव्हिटी करायला पण दम लागतोय, चालायला त्रास होतोय.
Right.
Every day they will have some cough production, sputum production will be there. So that is one important difference. But more than that, scientifically, if you ask me, asthma is a disease of only lungs, and COPD is disease not only of the lungs, it's the entire body.
Oh.
Okay, so we have a lot of patients with COPD, those who have heart involvement also. Okay, so they will have involvement of your musculoskeletal system. They are more prone for osteoporosis, then anxiety, depression. So each and every organ, so it's a multi-system disease.
It does affect.
It does affect. So that is the major difference. So why, as a pulmonologist, we always want to decide there is asthma or COPD, because there is a different spectrum, maybe of the same airway disease.
Yeah.
But COPD, there is a multidisciplinary management. So maybe we'll involve a cardiologist, get 2D echo also done. Okay, maybe we will involve a musculoskeletal physician. So all those systems needs to be taken care of when we are dealing with COPD.
Right.
COPD patients have very high chances of going again and again in the hospital. So I have patients like right now also I have recurring issues. It's like a backdoor entry. They come out, patients feel, "Arey, आता बरा आहे का?" 2 दिवसानंतर पुन्हा same. So it is like a, I mean, that is, we are talking about the end stage COPD.
Okay.
Still, it is a manageable disease. It is not that we can't manage it, but that is the difference between asthma and COPD. These are two
And
spectrums.
asthma we know is a kind of manageable.
Yes.
पण त्याला काही cure आहे? How can it be manageable for life?
Yes, again, one is, first and foremost, what I tell all my patients is it's a lifestyle disease.
Yeah, you have
It's
to
a
live with it.
lifestyle disease, yes. So it is like, it is, you're not, there is no permanent cure out of this. Okay, patients will have some waxing and waning symptoms, येतायत जातायत, and in the between they have to modify their lifestyle. Whatever we discuss, this sunlight and the biological clock and the whatever those things we have to avoid.
Yeah.
And most important is the dust. 90% of asthmatics, they have trigger is through the dust.
Yeah.
And now in Pune also there was a lot of rain, so almost each and every house they will have some dampness in the wall. There is a lot of mold exposure, and you are sleeping with that mold. The mold goes inside your lungs. Okay, so they have to basically avoid dust exposure. आणि dust म्हणजे लोक म्हणतात की नाही, माझं घर अगदी धूळच नाही माझ्याकडे. But this sofa, carpets, pillows, so they have this all microscopic dust. Okay, so that you can't see, you and we can't see with the naked eye, but that is the thing which can just go inside and then it can trigger all of this dust. So dust and pollen exposure. And the most important treatment for asthma is to take the inhaler. Okay, which even in 21st century also people feel that no, I should not be taking inhaler, or it's a, they feel that there are some beliefs, myths about the stigma about it. But that is the best kind of therapy, because the inhalers, they will go directly inside the lungs, just like maybe your local eye drops, or if you have a skin condition, you'll just put some ointment on the skin. So same way it will have a direct impact on the lungs. So the systemic effects are very, very minimal. Dose is in micrograms as compared to any of the tablet. So they have some small dose of inhaled corticosteroid. So people get worried about the steroid part. But if they don't take these inhalers regularly, the question you just asked me, asthma, COPD ला फरक काय? So long standing asthma, if they don't take these inhalers regularly, that will convert
into COPD. Okay.
So to prevent this, I think they have to take regular treatment, be compliant with their inhalers, and there are a lot of good medicines available. So nowadays there are medications which are called biologics. Okay, so which are like to be given, they will block your allergy pathway. Okay, so once you inhale some allergy, your body will respond with some kind of allergy inflammation. So there are injections which can be taken once a month, once in 2 months, and then they can block that allergy pathway. Okay. So there are a lot of these new things are there. There are lung functions equipments are there. So pulmonary function test. Then there is a test called FeNO. It's a body box that even when you are breathing, how much is your oxygen, carbon dioxide remaining inside the body? How much is the lung capacity? So a lot of these things are there. So just like people want to use the technology, but they don't want to use the drugs. Okay.
Yeah.
So AI सगळ्यांना करायचंय. But if we talk about anything which is a newer development or any kind of newer medications, they don't want to comply with this.
They don't want to experiment.
Yeah. But they are not now experimental also. They are very well proven. Okay. So I think
with times we need to keep adapting.
We need to keep on adapting. We cannot keep on practicing the same old medicine which was there 20 years, 25 years back. We have to move on with the time. And a lot of good things are there.
Absolutely. Doctor, lung fibrosis बद्दल पण मी फक्त ऐकलंय, पण can you please explain in detail काय असतं, काय cure आहे, how do you deal with it?
So what we discussed, asthma, COPD, हा basically श्वास नलिकेचा आजार आहे. Okay, it is the air pipe. And then we discussed the structure of the lung, where are those alveoli are there, so they are deep airways. And then so lung fibrosis is basically the disease of that parenchyma of the lung. Okay. So where these alveoli are there, and where the basically air gas exchange will happen. Okay, oxygen will dissolve inside your bloodstream through those alveoli. Okay, so lung fibrosis, basically your lungs get stiff, they become shrunken, they become scarred. Okay. So when you take a deep breath, your lungs have to expand. When you release, that time the lungs have to again, they have to go back to their normal position. So this elasticity of the lungs, so that is basically hampered because of scarring inside the lungs. So that is lung fibrosis in a layman's term.
Okay.
So lung fibrosis, it can be again now because of n number of reasons. So if you see medical textbooks, we have at least 400 different types of lung fibrosis. Okay. So there are people, those who are practicing only lung fibrosis. In foreign also there are ILD, interstitial lung disease. So there are ILD clinics. Okay. So there are people those who will follow only ILD clinics. Okay. Common reasons आपण आता सोशल मीडियावर बऱ्याच वेळा बघतोय, पिजन एक्सपोजर. Okay. So that is one of the commonest reasons, and even I have lost young patients because of pigeon exposure. Thanks to the government that they have come up with some kind of, at least some strict law against the use of or feeding pigeons. Okay. So that is there. Again the fungus and the mold exposure. काही वेळेला इवन खूप जुना AC असेल, त्यातनं पण continuously fungus exposure is there.
Right.
So even they can cause, and this is not an overnight thing. Okay, just like asthma, की नाही मी एक्सपोज झालो आणि मला लगेच त्रास झाला. So people, they get worried. For example, pigeon exposure, day before I had one patient. Oh, there was one pigeon in my balcony, and after that I think I have got lung fibrosis.
एका दिवसात नाही होत.
Yeah, it's a
But then what
long
happens
years.
in the pigeon exposure? I want people also to understand how grave is the situation around this controversy.
Yeah. So the situation can be grave, especially if it's a long-term exposure, because what happens is, it is not the pigeons, it is their vishtha ji asते pigeons ची. Okay, so that excreta, and especially the dried excreta. Okay, if it is there for even days, months, so it will keep on secreting some kind of avian allergens. Okay, and these allergens, then they get exposed, and lungs are like, any particle which is a very small size, 2 to 5 microns, that will go and lodge inside the lungs. Okay, so God has made lungs in such a way that whatever goes inside the lung, it will stay inside the lung. Okay, especially all your diesel exhaust particles, your pollution, if they are very small, they will taken away by the bloodstream. If they are big enough, they will caught in your major passage, but 2 to 5 micron particles are the one which will get lodged, and they will reside inside the lungs.
That's
okay,
bad.
it's like a sponge. Okay, so even if you take the sponge, if it is filled up with millions of pores, small spores are there, even if you squeeze it,
it's not going to come out.
You cannot clear it. So same way, whatever these excreta, these avian allergens, whatever goes inside the lungs, they will stay inside the lungs. Okay, and then over a period of time, it will cause inflammation inside the lungs. So with pigeon exposure, sometimes there can be acute hypersensitivity pneumonitis. Okay, somebody who has fed a lot of pigeons and there is a lot of excreta which they cleaned, so acutely they can get reaction. Okay, you don't have to worry about them. Okay, if we diagnose them by doing a good quality CT scan, a good history, a doctor who is able to take the history, and the patient also says, yes, I have done something like this. Okay, we give them steroids, we give them some kind of medications, and they are cured. Okay. Suppose one exposure, again second exposure, again third exposure, every time that exposure keeps on happening, then your lungs will behave differently. Then they won't respond to and the inflammation will be more than your recovery phase, and then it goes into that chronic fibrotic phase. Okay. So this we can diagnose by doing a very good quality of CT scan. Okay, so again I would like to emphasize, it's a good quality CT scan. Okay, because what's happened is, in COVID also we all have done dozens of CT scan, श्वास घ्या सोडा आणि CT scan is done. If we do a very good quality CT scan, wherein Ruby also have very good protocol for this, we ask the patients to sleep on the back, then on their tummy, and then take breath, release breath, and different kind of these CT scan pictures are taken, which will be able to diagnose if the patient has this kind of lung fibrosis. So that is, if it goes to that stage, then still we have steroids, we have certain kind of anti-fibrotic medications which will prevent the fibrosis. We have to follow up these patients very regularly. Every 6 months, 1 year, we see these patients, we have to do their lung function test. So it is not a deadly disease.
You said you lost a patient, a young patient.
Young patient, yes. So, I mean, and then somebody who comes very late. Okay, if they present only late and by the time you do your
it's too
CT scan shows that it is completely fibrosed. म्हणजे honeycombing, मधमाशीचं पोळं असतं तसं पूर्ण lungs they become like a honeycomb. Then that time you can't do much. Okay, of course we have now lung transplant, we have a lot of other therapies also available for even for these kind of patients, but it is one more example I can give you for lung fibrosis, which is very common in Pune also, is floor mill workers. Okay, पिठाची गिरणी. आणि I mean there are certain samaj, like there are some people those who come from Rajasthan and they say that we don't know any other work, we know only this work, आणि आम्हाला एवढंच शिकवलंय, आम्हाला हेच करायचंय, we cannot do anything else. But then we don't have specific laws for this, what kind of mask needs to be used, how much time they are getting exposed. Okay, only 4-5 hours if they get exposed and 20 hours if they are maintaining good health, of course we can prevent some of these patients. So even that is called silicosis, कारण ते काय करतात, ते टोचा मारतात. Okay, so they will keep on doing that, hammering with the so that that floor mill will work better. But then whenever they are doing this, that silica particles they get exposed, and mining exposure. So all these are basically reasons for lung fibrosis, occupational hazards. So all this will cause lung fibrosis. Ultimate treatment for lung fibrosis remains is lung transplant. Okay, we are also coming up and we have already started our procedure for lung transplant. We have got license also for this. But I mean it's a different science, it's a different it's not like a rocket science that I have this problem, I came and I did lung transplant, but it's a big way to process. It's a but prevention is the most important thing for all of these lung issues.
Absolutely. Doctor, India still reports TB cases?
Yes, a lot.
What should patients do? What should families do to prevent and protect themselves?
Yeah, TB is, I mean, rampant in our country. You see any executive and even a poor guy, okay, all class of patients we have TB. TB is like for each and every organ in the body. It may not be only lungs, it may affect even your eyes, your brain, your kidneys, your liver. So each and every organ can have TB. Not each TB is transmissible. Okay, that is also again people, because somebody has a node, okay, lymph node TB. So lymph node TB is not transmissible. Okay, so patients have a lot of misconceptions about this. Okay, so basic is somebody who has lung TB. Okay, so then they may get some cavitations inside the lungs, म्हणजे holes तयार होतात lungs मध्ये. So they may get cough, they may get blood in the sputum, they may get fever, okay, for long time duration. And then these patients, they can basically spread TB from one person to another when they are coughing. Okay, it is not each and every TB is transmissible. Whatever we have learnt in COVID, keep 6 feet distance, use mask. Okay, so I think these are the common ways to prevent tuberculosis, and keep your immunity good. Okay, we all are exposed to TB. You, me, we all are exposed to TB, but we may not develop the disease because our immunity is strong.
Definitely.
Okay, if we eat on time, if we sleep on time, the immunity level will take care of TB. So it will be only TB infection. It won't convert to a TB disease. Okay, so first important is to just avoid certain things. One more thing which I think all my people also have to understand is we have to have this practice of cough in sleeves.
Yeah.
Okay, it's a very simple etiquette which I think even teachers and in the schools also, why everybody coughs like this or openly? Why can't they cough like this? There will be so much of place. Easy ahe. Okay. And another is to have a strict law against public spitting.
Yeah.
Why we have so much of spitting? म्हणजे कोणत्याही बिल्डिंग मध्ये पण कोपऱ्यात ते देवाचे फोटो लावतात आणि देवाच्या फोटोवरती पण लोक करतायत स्पिटिंग. सो दिस स्पिटिंग इज समथिंग विच इज गांभीर्य नाहीये आणि त्याच्यामुळे स्प्रेड होतोय. सो टीबी बॅसिला इफ दे आर लाईक थ्रोन इन द एअर, ओके, अँड इवन इन द good sunlight of 40 degree also, they can stay for months together.
Baapre.
Okay, so that is how the TB basically spreads. So somebody who has TB, if he is coughing, then the entire floor is then they have TB bacilli infected. Somebody touches it or somebody swipes the floor and then you get exposed. Okay, and if your immunity is not good, that is how TB spreads. So I think to keep immunity and to change certain things, overcrowding and this population we have, but I think we definitely have a plus point also of managing them more effectively, because we have so much of people to take care of all of this.
Right. So, I want to come back to chest infections. हे सीझनल असतात, कुठल्या पर्टिक्युलर टाइम मध्ये जास्त शक्यता वाढते, पॉसिबिलिटीज वाढतात?
आता आपल्याकडे सगळे सीझन सारखे असतात. सो वी हॅव रेनी सीझन ऑल्सो गोइंग ऑन, वी हॅव विंटर ऑल्सो गोइंग ऑन, एव्हरीथिंग इज, बट डेफिनेटली चेस्ट इन्फेक्शन्स दे हॅव दिस सीझनल पॅटर्न. ओके, एस्पेशली फ्लू.
Right.
Okay, so we all are worried about COVID, but we are not worried about flu.
The regular flu
the
that we
regular
have.
flu. So right now also in Pune also we have H3N2, H1N1. So these are like two common flu what we
Yes.
see very commonly. Then we have RSV virus, which is a respiratory syncytial virus. So this is also very common and it is there. So they are basically normally just pre-winter season. So that is the time when we do get this.
Yeah.
So most important viral seasons, the viral will have definitely the seasonal prediction. Bacterial like TB, pneumonia, they won't have any kind of seasonal prediction. Okay,
Right.
they can happen anytime. But again, most of the bacterial infections also they happen after viral infection. Okay, तर पहिल्यांदा viral infection झालं, flu झाला, and post flu there is pneumonia.
Right.
So that is how even the pneumonias will have some tendency to have seasonal variation, but more of these are viral
Diwali is the
infections.
biggest season.
Diwali is the biggest season, and especially whether there are public gatherings.
Yes.
Okay. Ashadi Yatra,
Oh.
okay, then post Diwali. So when people come together,
Yeah.
whenever there is a celebration, so that time there are the outbreaks of this kind
These
of
flus.
flu.
And what about vaccinations? How important are these, especially in terms of adults
Yeah.
who have lung diseases?
Yes, very important role of vaccines, because we all take our children chala vaccination clinic class. So India is still yet to see the days where we are taking our parents to the vaccination center, and there are not less than 15-20 adult vaccinations which are there. Okay, but for the lungs, I feel there are 3 vaccines which are important at present. So one is a flu vaccine. Okay, flu vaccine can definitely, it works so well that I have patients those who come to my OPD and then they will say the receptionist, no, I don't want to meet sir, I just want to take that flu shot. Okay, so they get benefit out of it.
That effective.
That is that effective. And even if they develop the infection, that will be just like upper respiratory, 1-2 दिवस ताप आला and then it is subsided.
Okay.
I really feel sad if somebody dies because of flu. Okay, because flu can take life, and we have such an effective vaccine which is a quadrivalent vaccine. There are 4 different flu viruses, and every year we will have a new strain of these vaccines. So every year we need to take seasonal flu vaccine, maybe pre-winter season. So especially all patients of our asthma, COPD, lung fibrosis, even pneumonia, diabetes patients, heart failure patients, kidney failure patients, so they all should take this flu vaccine once a year. And one more very important vaccine is pneumonia vaccine.
Okay.
So pneumonia vaccine, आता pneumonia म्हटलं की all kind of lung infections are basically pneumonia.
Yeah.
Let it be virus, let it be TB, they all can cause pneumonia. But there is one specific pneumonia which is called pneumococcal pneumonia.
Okay.
That is the commonest bacteria which causes this pneumonia. So they have to take this vaccine which is available, and it is once in lifetime.
Oh.
So we recommend for all patients of more than 50 years of age group. For somebody who is having high risk, we can give a booster after 4 years, after 5 years.
Okay.
But otherwise, pneumonia vaccine is something again very important, and it is again very effective. And they are not like, if we talk about vaccines, people say, I had taken COVID vaccine and then I had this trouble. So they should
काही
not
संबंध
correlate.
नाही.
काहीच नाहीये, because this was like an emergency use. And we all are alive because of COVID vaccine. If
Yeah.
you ask me, actually,
Absolutely.
I always feel it that way. But these flu pneumonia vaccines, they are time tested, they are there for centuries together. So we should make good use of it. One is shingles vaccine, shingles chicken pox.
Yeah.
Okay, that is again very common in patients, especially those who have COPD or patients those who have asthma, weak lung immunity. So shingles vaccine, chicken pox, because even that can cause sometimes a lot of dreaded complications also. Shingles pneumonia also does happen. It can affect the eyes, it can cause deafness. So we have a shingles vaccine which is also available for more than 50 years of age group. 2 dosages needs to be taken 6 months apart. So these are like few of the vaccines. Of course, COVID vaccine was there even if they were taken, but still these vaccines are important.
I will bring my parents.
100%.
Nakkiच.
Yes.
And lastly, doctor, in the beginning of the episode, आपण discuss केलं की how sleep is connected to your respiratory system. So, what are the different sleep disorders that you commonly see, and how are they connected again to these respiratory diseases?
Yeah, it's I mean, my passion is to develop sleep medicine, and each and every person should know about the importance of sleep. Okay, because that is how you can move to the preventive aspect. Holistic approach to all the lung diseases is through the sleep. So what we see commonly sleep disorders सगळ्यात common is insomnia, झोपच येत नाही. Okay, so that is the most common thing. But as a respiratory physician, what I see more commonly is sleep apnea.
Yes.
Okay, so sleep apnea is something, if you see the prevalence, almost 8 to 10%, म्हणजे 100 10 लोकांना जर sleep apnea आहे. So, and these sleep apnea patients, they will come to you in the morning hours, they will have morning headache, they will never have a refreshing sleep in the morning, or they feel that my sleep is never complete.
Yeah.
They can doze off to sleep anytime in the daytime. I have people, those who have slept like having a conversation, they can just doze off in the clinic. बसल्या झोपतात. Road traffic accidents because of sleep apnea. So these patients are most common. And what we discuss, COPD. Okay, so COPD and sleep apnea because of obesity, they again go very hand in hand. Okay, so many of our COPD patients, they will have sleep apnea issue. त्याच्यामुळे कार्बन डायऑक्साइड अजून वाढतो. In COPD also we have this issue with carbon dioxide, and in sleep apnea because of their choke up in the upper airway, blockages. So they have like typically short neck, and they are not able to, when you ask them to say so even that time also you can figure out that there is very little space for the air to go in, bad air to go out. So because, and when we sleep, we all have decreased muscle tone. So our muscles or your pharynx, it completely collapses. So once it collapses, then you will be like choking for breathe. And then as if कोणी गळा दाबल्यानंतर तरी तुम्ही, so your sleep, which normally has to function in your favor. Okay, like during sleep your heart rate should go down, your blood pressure should go down, it should be resting and rejuvenation of the body. But those who snore or those who have this sleep apnea, so their heart rate will keep on increasing at night. So we have seen patients कि BP कमी येत नाहीये, okay, and they are on 4-5 BP medications, or heart failure component is there, and they are on multiple medications, but still heart failure is not improving. And you put them on the CPAP machine for the sleep apnea, and the BP comes down, okay, or your heart failure component also comes down. That is because basically you are not getting oxygen at night. Okay, so pranvayu आहे. So if you are breathing at night with completely choked pipe, so then how does things happen? So that is most important, is the sleep apnea. So we have to be very carefully ask all our patients that sleep apnea is something which we need to take care of. There are a lot of treatment options available for sleep apnea. Patients don't want to use CPAP machine. First and most important is weight reduction. Okay, just sleeping on sides or just elevating your head end of the bed. So those things also will definitely help. Okay, bariatric surgeries are there. Now we have a lot of weight reduction therapies available. Weight reducing medications are also available. So they can decrease weight. They can definitely effectively treat sleep apnea. We have certain kind of devices what patient has to wear inside their mouth, that is called mandibular advancement device. So they just like have to use at night, and they will just pull your lower jaw a bit forward at night, and it can just create some space inside your airway. So sleep apnea is something which is very commonly we see. We have one more very important sleep disorder is shift wake sleep disorder. Okay. So many of the patients, especially those who work in IT or those who work with the the night shift असते, day shift असते. So 4 days a week they have night shift, 2 days a week they have constantly changing their routine. So they will have, their brain doesn't know आता दिवस आहे का रात्र आहे. So this is shift wake sleep disorder. So even these patients also we do see very commonly in our clinical practice. And then there are patients, those who have extreme like झोपेत चालणे, झोपेत बोलणे. Okay, so then they can do any kind of even legally challenging certain kind of activities they do at night, and then they are not aware. So a lot of sleep disorders we see, and they have important connection with this respiratory, as I said, that because all your immune system basically happens at night. So if you have patient with sleep apnea and if you treat them, then definitely their allergy component, their COPD component, it all reverses. Okay. So there are a lot of patients, those who with the use of machine, they can become better with this novel technology, which is a very common disorder. Okay.
Fab. Lastly, तुमची sleep health improve करायला काय लोकांनी करायला पाहिजे आणि so that हे disorders होऊ नयेत?
Yes. So the first and most important is again give a lot of importance to sunlight. Okay, देवता आहे आपली, आणि we have to follow our all bodily routine as per the sunlight. Okay, have timely meals. Everything should be on proper timing so that your biological clock will set. Once your biological clock is set, all your other peripheral organs in the body, they will just follow it. Okay, so that is most important. So even if they are not able to follow everything, just if they follow time to go to bed, okay, then everything will automatically follow. People, those who are not able to sleep and to improve sleep health, give importance to sleep.
Yes.
Okay, invest in good quality of mattress, invest in good quality of chadar, pillows, whatever. Okay, give a lot of importance. There should be absolutely distraction free,
Yeah,
no joint
scrolling
pains
करत
and
बसलेत आणि
aches.
मग झोप
Yes,
लागते.
that is very. I mean, because normally you have distance of at least 1 feet when you are reading. At night when you are having mobile, you keep
इकडे
it here.
असतं.
Okay, so it is 10 centimeters only.
Yeah.
And whatever this blue light, it will stimulate all your ganglion cells inside your retina, and they will have that visual impression for 1 hour. Okay, so that is the most important thing. They can start taking maybe shower 2 hours before going to bed.
Okay.
It stimulates a lot of your thermal center and sleep center. They are side by side in the brain. Okay.
Oh, hot shower, cold
Hot shower, hot shower. 2 hours before. Not to do any kind of exercise in the evening.
Yeah.
Okay, maybe after sunset. Not let's not do any kind of exercise, or at least 2 hours before bedtime.
Yeah, because your body will take time to cool down.
To cool down. Maybe they can use even the hot napkin and just put it on their eyeballs half an hour before going to sleep. Okay, even sometimes even the hot towel on the neck of the neck, on the shoulders, that also can stimulate the sleep. Doing some kind of chanting. There is something called as white noise. So some people, they have fan चालू असेल तरच मला झोप येते. So that is a noise.
Yes.
Okay, so all other distractions are left, and you can just
Focus
listen
on
to
one
that
thing.
particular thing, and then you can go to sleep. Okay.
Right.
So I think
There are so many ways.
so many ways we can definitely improve on all of this.
Great. I think खूपच informatory होता है episode. People, in fact, even I got to learn a lot of things about lungs, respiratory, sleep, and basic जे एरवी माहीत नसतात किंवा मिथ्स असतात. सो थँक्यू सो मच फॉर युअर टाईम. थँक्यू सो मच फॉर एक्सप्लेनिंग इट सो सिम्पली. इतकं सोपं करून सांगितल्याबद्दल. आणि आय एम शुअर पीपल विल टेक अवे व्हेरी इम्पॉर्टंट फॅक्टर्स फ्रॉम युअर ओपनिंग अँड एंडिंग स्पेशली. इफ यू फॉलो द सन,
Yes,
everything will follow
absolutely.
perfectly well. Thank you so much, doctor.
Thank you.
Guys, if you have any questions, any suggestions, anything you want to share, you know what to do. Go in our comment section. Let us know how you are liking the episodes. And yes, take care of yourself. Thank you.